What is PAS? PAS stands for Placenta Accreta spectrum, also known as morbidly adherent placenta. It describes the abnormal invasion of the placental tissue into or through the myometrium, and it comprises of three distinct conditions. One is the placenta accreta, and this is what is the classification of PAS. So the first is the placenta accreta, then the placenta increta, then third is the placental percreta. It is mainly due to the defect of the decidua basalis, which allows the invasion of the chorionic villi into the myometrium. So when you talk about the classification of PAS, you have the placenta accreta, which I told. Here the villi are attached directly to the myometrium, but they do not involve the musculature. Increta is when the villi partially invade the myometrium. Percreta is when they invade through and through beyond the uterine serosa. It may involve the bladder. So this is the classification of placenta accreta. Let's talk about the risk factors. Prior cesarean section and prior history of placenta previa are two most important risk factors for PAS. It increases the odds of having placenta accreta by about 8.7 or you can say 9%. Deficiency of decidua basalis at the site of scar is the causative factor. Placenta previa with previous C-section doubles or increases the risk, okay? And the risk increases with the number of cesarean sections. And that's why we are routinely seeing a rise in the number of PAS cases, because there is a significant rise in the number of cesarean sections. Advanced maternal age, that is multiparity, advanced maternal age along with multiparity, uterine anomalies, previous uterine surgeries, dilatation curettage history, previous history of any myomectomy are also considered relatively minor risk factors. They also have abnormally high second trimester serum markers, that is elevated levels of AFP and HCG. Abnormal placentation in any form often rises these markers. So this is a very non-specific yet maybe a handy tool in future to raise the suspicion of PAS. Also remember that a cesarean scar pregnancy diagnosed in early pregnancy can evolve into an abnormally adherent or invasive placenta in the second half of pregnancy. The outcome of cesarean scar pregnancy depends on the amount of definite placenta developing inside the scar and the depth of the villi invasion. So these are the risk factors for placenta accreta spectrum. Stay tuned, we shall be discussing more about its management and diagnosis.